Hi, my name is Lord Cabahug, and I'm going to be showing you how to properly administer insulin subcutaneously. And after that, I'm going to be showing you how to assist a patient, how to perform a one-person transfer with a transfer belt. So the first thing you need to do is to perform hand hygiene and introduce yourself to your patient. Hi, my name is Lord Cabahug, and I'm going to be a practical nursing student today. Next, provide privacy to the patient. Next is to identify the patient with two identifiers, such as their name and birth date. Next is to adjust the height of the bed and the side railings for your with your comfortable preferences rather. Sorry. Next thing you need to do is to do assessments prior. So I would have to, for insulin administered subcutaneously, I would assess the lower abdomen area because because insulin absorbs faster there. And after doing so, I will get the client's vitals. So temperature 37 of normal range. Pulse is 85, which is strong, steady, normal +2. Respirations is 12. Steady, regular, deep, effortless, not using any accessory muscles. SpO2 95, BP 120/10, and pain if the client is feeling any pain. Next, I would have to verify the MAR with the physician's orders, as you can see here. So the physician has prescribed Humulin R insulin 12 units with Humulin N 10 units to be administered subcutaneously every 30 minutes, 30 minutes prior to the breakfast rather. Sorry, my tongue slipped. And in the MAR, Humulin R which, and Humulin N, which is both to be administered subcutaneously 30 minutes prior to breakfast time. Since the MAR does not have the right doses, I'm going to be referencing the physician's orders during my 3 checks. After doing this, I'm going to ask the client if they have any allergies. Then I'm going to inform the client that I will be preparing their medication and I'll be right back. And I will adjust the bedside. I will adjust the bed and the side railing and put the side railings up and adjust the bed to the lowest setting to reduce fall risk rather. So I'm doing my first checks. Before I'm doing my first checks, I'm performing hand hygiene again and wearing gloves. Next, I am pulling out the medication. So as I'm doing so, I am doing my 5 rights. So the right name of the patient, Mr. Sweet. Medication would be Humulin R and Humulin N. Right doses would be Humulin R 12 units and Humulin N 10 units. The right route would be subcutaneous. And then the right time would be 30 minutes prior to breakfast, which is indicated in both. Next, I would check the expiration date to make sure that these two medications are not expired. Next, for my second check, I would clean both vials. Just clean both vials. Oh. Next, I with a coworker will be witnessing me in pouring the medication and will be co-signing it and will double check if the medications are correct. So I am going to roll the cloudy first. After doing so, I'm going to aspirate 10 units of Humulin N, of air into Humulin N rather. Being careful for the needle to not touch the medication. Next, I'm going to aspirate Humulin R with 12 units, and I'm going to draw the medication after. Drawing 12 units. Next, I'm going to my cloudy. 10 units. Total of 22 units. And my coworker would witness this and will double check my calculations and will co-sign. Will co-sign the documentations later. So I would label the medication with some tape. I will label it with the kinds of medication, the patient's name, and the doses of each medication. So Humulin R would have 12 units and Humulin N would have 10 uh 10 units rather. And as I'm putting putting everything away, storing the medication and the insulin back to the med cart, I am doing the last of my last check, my last 5 writes. If it's the right name, Mr. Sweet, medication, Humulin N and R. Dose would be Humulin R 12 units, Humulin N 10 units. Route would be subcutaneous. Time would be 30 minutes prior to breakfast. And I'm going to the patient's bedside, readjusting the height of the bed, putting the guardrails down, and then, sorry, and then I would do, I would perform hand hygiene again, wear gloves, and then I would inform the patient of their 5 rights, such as their right reason to help them with their diabetes and regulate their insulin, their right to refuse if they have taken this medication like earlier today, maybe, or they just refuse for some reason. And their education, I would have to educate the patient on the signs and symptoms of hyper and hypoglycemia. And the last 2 rights will be for later for documentation and evaluation. So for the administration, I will clean the site of injection first, pretending this is the abdomen, the lower abdomen. I am cleaning it for 30 minutes. 30 seconds. 30 seconds rather, sorry. And I'm disposing of this. And I have a cotton swab ready. And I'm removing the cap first. I'm going to give a slight pinch, and I'm going to hold it like a dart. And I'm slowly administering the medication. And before removing the needle, I'm counting 10 seconds. After doing so, I will release the pinch and pull the needle out and putting pressure on the site of administration. And I will put this to the sharps container. I dispose of it to the sharps container rather. And after doing so, inform the patient if they ask the patient if they need anything else, and leave their put the bed to the lowest setting, put the guardrails up to reduce fall, and tell the patient to uh, to ring the call bell if they ever need anything else. And yeah, that is how you properly administer insulin to a patient.